And I remember I did a podcast actually near the start of the pandemic, um, and one of the things I mentioned was the fact that this is the time where my belief in resurrection, my belief in life after death, is really gonna be put to the test.
I'm here with Dr. Benjamin Chang, um, who's a doctor, also a Christian, and is going to be speaking to us about what it's like to be a Christian and a doctor. And Ben, I won't introduce you too much more, but you were a doctor in an accident and emergency department, or an A&E department in a hospital in London when the pandemic broke out. Do you want to tell us a bit about how was it being a doctor through the coronavirus crisis?
Yeah, absolutely. And thank you so much for having me. It's great to chat. I mean, the last few months have been a very strange time to be a human, and very strange time to be a doctor as well. There's been lots of big changes, lots of quite major things that I've certainly never experienced before. I've seen more dying patients than I've ever seen. I've seen more patients come in who are actually colleagues of mine who I've had to treat. Lots and lots of my doctor friends went off sick with COVID. So it's been a really, really tough and challenging time. But it's also been a time of immense opportunities. Um, I am certainly finding that people around me are much more keen to talk about the big questions about life and death. My friends and colleagues, but then also further afield. I think there is a hunger in certainly in my society of wanting to discuss these things, sometimes for the first time, and it's certainly producing a lot of opportunities for me to talk about the big questions and talk about faith as well in that. So yeah, it's been very challenging, but also has come with a lot of opportunities.
Yeah, I'm sure it must have been quite a challenge as a doctor, particularly with the a colleague sick and risk to yourself and all of that. But yeah, as you say, great opportunities for the gospel and to talk about the big questions in life. But if we rewind a little bit, we first met when we were students, and I'm wondering, as a student studying medicine, what were the particular challenges, opportunities as a Christian studying medicine?
Yeah, it's a really good question, and I'm aware that many people watching this will be students in healthcare in some form. Um, Medicine, nursing, healthcare subjects have lots of challenges and lots of opportunities, and I would argue that often they're the same thing. So in medicine, you have to tackle some really difficult, challenging, confusing topics, but also topics that are really important and that will change the world. So issues around value of life, beginning of life, end of life, issues around emerging biotechnologies and what is ethical and what is not, issues around health economics and the distribution of healthcare. These are big topics that can make your head spin, but these are really important in wider society. And also, I would say that if you work hard as a Christian in medical school, you'll be laying the foundations to be really being able to make a difference in the world for Christ as a doctor. There are many ways that we can do that as a Christian working in healthcare, but also as a doctor a doctor in the church. So let me just unpack both of those. So there are so many opportunities Christians have to make a difference in the secular world of medicine. I mean, one example would be that Christian doctors are the ones who've been leading the fight for the rights of the unborn child and the dying patient. I mean, palliative care was invented by a Christian nurse in the UK called Cicely Saunders, and she has changed the world and made differences to countless lives. So there are many, many opportunities for Christians to make a difference in the medical workplace. But I do also think there are many opportunities for doctors to make a difference in the church. So I often say, you might have the most wonderful and in-depth knowledge and theology of Psalm 139. I'm fearfully and wonderfully made. You knit me together in my mother's womb. You may know that psalm really well, but that's not going to tell you what contraceptives you should and shouldn't use. For that, you need doctors who are able to help and guide the church through these difficult and new and changing medical ethical issues. Or to take another example, say mental health. The Bible talks a lot about fear and anxiety and joy. And at medical school, we learn lots about antidepressants, SSRIs, and cognitive behavioral therapy, and all these kind of medical and clinical interventions. If there are people who can combine those two, what the Bible says about mood and joy and fear and all that, with clinical knowledge, then you can make a huge difference to people in your church and people that you know. So I think there are lots and lots of challenges, but also opportunities for Christians in healthcare.
That's really helpful. Thank you. And then if we move a little bit onwards then from kind of studying and the kind of theoretical side of being a doctor, what about the actual experience, the practice of working as a doctor in an emergency department? What are some of the highs and lows, and what difference does it make that you're a Christian?
Yeah, I mean, the highs are very high and the lows are very low. I mean, the lows, I've seen people die. I've tried to save people from dying and failed. I've comforted parents who've just suddenly lost their children. I've broken the news to people that there's nothing more we can do. These are awful. These are horrible. They really do stay with you. But the highs are so high as well. Being with people at their moment of need, able to help them, able to save lives, able to make a difference is just amazing. And such a privilege to do. And I think it's such a privilege to do specifically as well as a Christian. When Jesus is asked about the greatest commandment, love God and love thy neighbor, and he's asked, who is my neighbor? He responds with the parable of the Good Samaritan. This is the story of dirty, gritty, humble, practical, effortful, self-sacrificial, expensive love for those in need. And as a doctor, I get to do that as a living, to give this practical, physical, dirty, expensive love. And that is a remarkable privilege as a Christian. So that is such a wonderful thing to be able to do as a Christian.
Mm. And I remember in the past you've mentioned about like the challenge of it's one thing to care for someone because you're being paid to do it, and quite another thing to actually really love and respect your patients as people made in God's image. How has that challenge been for you just these last few months?
Yeah, I mean, it's in the accident and emergency department in April and beginning of May, we had enormous numbers of very, very unwell patients come in. And as it happens, my hospital is surrounded by care homes. And so we got lots of patients who are in their kind of 70s, 80s, 90s coming in very, very unwell. And so and actually one of the most upsetting things about that period was that we weren't allowing families in. And so we had lots and lots of patients coming in, suffering, and in some cases dying alone. So without family, without friends. It was really sad. And I was talking to a friend of mine, not a non-medical friend, and I was telling her this. And she made this offhand comment of, yeah, but it's a good job that at least they have you, talking about us doctors and nurses. And this kind of like light bulb went off in my head, and I suddenly realized, hang on a minute, these guys aren't alone. They have us. If we are willing to put effort into taking that place of that relative, of being that human presence in the midst of suffering. And that totally transformed the way that I dealt with COVID patients. So from that point on, I found myself holding more hands, kind of just staying at the bedside for that, a few seconds longer, just to be there for them, not to add any more interventions, but just to be there, to be that human. I found myself asking, is there anything more I can do more often? And this is while dressed head to toe in personal protective equipment with masks and dripping with sweat, and wanting to get out of there as soon as possible. But I realized that actually, people who are suffering often just want a human presence there, and in that moment, it was just me. I was the only one who could, and that was quite quite a remarkable realization for me, but also such a privilege to be able to do.
Yeah, wow, that's deep stuff. And what difference would you say, like, sort of the Christian perspective on eternity puts on your work and your studies, your career as a doctor? What difference does eternity make?
Yeah. I would give two answers to that, kind of one personal, one more patient based. I mean, on a personal level, like when this pandemic started, there was lots of talk around personal protection and risk to healthcare professionals. And I remember the first time that a doctor died in the UK, and then we kind of, every few days, there'd be a new healthcare professional who had died in the news. And there was genuine fear among my colleagues, to the point that some people just didn't want to come. And I remember I did a podcast actually near the start of the pandemic, and one of the things I mentioned was the fact that this is the time where my belief in resurrection, my belief in life after death, is really gonna be put to the test. And my prayer was that my hope that even if I die, that's okay because I have eternity ahead of me. My prayer was that that belief would shine through in some way, that there'll be something about me that my colleagues can see, that I don't fear death, that I do believe in resurrection. And I don't really know what that looked like, but I certainly made a difference to me. The fact that I could go in to work knowing, I'm young, I don't have any major medical problems, so I'll probably be fine. But even if I wasn't, my hope is secure. My eternity is secure, because I do believe that one day I will rise from the dead and be with Christ forever. So that's kind of the personal way that my faith has helped me. I think in terms of like patients more generally, doctors, especially if you work on the wards, often have maybe 20, 30, 40 patients who they're looking after. And it's very easy for patients to become numbers and jobs lists. It's very easy to objectify patients. Bed 4, they're the one with the blood potassium level of 6, and bed 5, they're the one with the difficult family who always is calling. It's very easy to look at patients as projects or as jobs lists. And I think that being a Christian is, should change that. You shouldn't be seeing patients like that as a Christian, as difficult as that is. And so every time I see a patient, every time I try to say to myself in my head, this person is a person made in the image of God, a person that Jesus came to earth to die for. And I'm going to treat them that way, as someone who's immensely valuable to God and therefore should be immensely valuable to me. And again, I don't know what that looks like from the outside, but I do hope and pray that it makes a difference.
Yeah, man looks on the outside, but God looks on the heart. So, yeah, we'll try to keep you in our prayers with regard to that. But if we think then for perhaps if there are students listening who are, maybe quite early in their studies, maybe about to become a doctor or a nurse, is there anything you wish you'd known or learnt as a student, perhaps as a Christian student, anything you wish you'd known when you were studying that might have prepared you for what followed?
Yeah. I mean, there are many things that I wish I'd I'd known. I think I wish I'd been told how difficult it would be. that it requires a lot of work. And I don't just mean passing exams, although passing exams requires a lot of work and it is challenging. But I do also think that we have to remember that medicine is challenging. Being a doctor is challenging. It will um, come with challenges that will shape you, change you, break you. And you have to be ready for that. But also, I do think as well that doctors hold such a revered and unique place in society that we do have a responsibility to work hard for that. So, what do I mean by that? So, you know, people respect doctors, and people will listen to doctors, and not just patients in the clinical setting, but more generally. And when I am invited to speak in various contexts, at universities, at churches, often it's because I'm a doctor, and people assume that I'm kind of knowledgeable, that I'm well read, that I'm rational, that I'm well thought through. And the reality is, often the things I'm asked to talk about are not directly relevant to medicine. I'm going to talk about science or about morality or about the evidence for the Bible or whatever it is. And so, in light of that, I think it's incumbent on me to take that responsibility seriously and actually be able to put in the work in order to kind of have that to take that responsibility seriously. People listen to you as a doctor. People listen to you as a Christian doctor. You have an important and valued voice in the world. We should take that seriously. We should put in the work. We need to be able to sit and read and learn and think and be careful and prayerful. And that's a responsibility that we all have. And I think I wish I'd been told that when I started med school.
Thanks, Ben. It's been great having you, being able to talk to you about these things. Really insightful stuff on both the medicine and the Christian life. So thanks for sharing that. I'm sure lots of people would appreciate your comments.
Thank you. Yeah, it's been great to be with you.